using drugs while pregnant. We've talked about it on The Factor in the past and talked about drug treatment for pregnant women. The National Institute of Health says they believe 5% of pregnant women use one or more addictive drugs. But now we know the Houston-Harris County Office of Drug Policy is looking into that topic and other drug treatment efforts. Joining us to talk about this is Dr. Katrina Forte and Dr. Dashiell Guyan. Glad to have you all here on The Factor Uncensored. So this latest study that you guys are, how big of a problem is this with pregnant women?
It's a bigger problem than's been talked about, that's for sure. And you did bring it to our attention in particular. Pregnant women already are an underserved population, and because of various reasons, not a lot of research is done with them. But being pregnant already puts you at risk of death, and then using drugs doubles that, especially in African-American women. So it is a large problem. And
we had no idea the last time we talked about it here that it would become a part of your program.
Absolutely. So I did.
So what happened here on The Factor that made you guys say, we need to look at this?
What happened is after we concluded our conversation, I reached out to Dr. Guyan, and we talked about the research that we would be doing. And I brought up this topic, and he was like, let's include this. And it's a need, obviously. You know, you brought it to the public's attention that it is a need that needs to be addressed, and that's what we're looking to do, survey community needs.
And Dr. Guyan, is this something that family members and friends of those women who may be pregnant are not talking about, even though they see it?
Yes, it is. And it is something of significant concern with regards to families and the issue itself as it relates to that. Drugs with pregnant women is very much so a concern in the family.
And so if you realize someone that you know may be pregnant on drugs and putting her life and that of the child in jeopardy, who should you go to if they are not listening?
I would reach out to various resources that we have. 211 is a great resource if you don't know where to start.
But for those who are wondering, if we call 211, are we snitching? Are we putting them in criminal jeopardy?
That is a really good question. Absolutely not. 211 is ran by the United Way, and all they do is connect you with resources. They do not report, you know, anything that's outside of immediate harm to children, elderly, the standard individuals that we're required to report. So no, they wouldn't face anything. They would just get the services or the resources they needed by doing that.
And what else did you guys conclude with your report that you have recently released?
Well, the study first began in 2017. It was a 2-year study that we conducted through the Office of Drug Control Policy here in Houston. We reached out to the community members, individuals who were attending our Community Drug Awareness Day. We have it every year. And we surveyed the individuals that attended this. There were other topics that were addressed. Decriminalization of marijuana was one of them. Prevention in the school-based prevention, community-based prevention, more money put into treatment, more money to put into recovery with individuals. There was also, we found that the public were interested in the law enforcement and the role that they play with regards to drugs. So we're at a point now where we are going to revisit those very same topics. Just past Friday, we had the annual Drug Awareness Day, and we started with preliminary data. We just collected the data. I don't know what exactly it's going to look like. But the information that we get from there, of course, is information that could be used for policymakers. It could be used for individuals who are perhaps doing additional research in that area. It's an ongoing process.
Absolutely. And so have community stakeholders and lawmakers shown any interest in the data that you guys have been able to gather? Absolutely.
I work with several individuals. I've worked in the past with Congresswoman Yolanda Jones on this. I've showed the research to her office. Currently, I am in talks with meeting with Dr. Oliverson in Cyprus about minor consent. A lot of people don't know that minors can consent or refuse substance use treatment with or without the consent of their parents.
They can refuse it?
Yes.
Really?
Yes, there's many children that are no longer here because they refuse the treatment and unfortunately got a hold of lace pills. And so I'm working on policy change or revision with several entities to visit that.
And so, Dr. Guyon, would that require a state law, an ordinance, or just policy change where parents can say, I know my kid is in trouble, get them the help they need?
Well, yes, and that's a very important part. When you mention about informing others, we've sent this information. This information is with Dr. Rahul Gupta, the drug czar, out of the White House. He has a copy of the very same research and reports that we were doing. So it's an effort, a considerable, big effort that we're trying to make to make a difference.
And thank you for the job you guys are doing. And we're glad we could play a role here on the Factor Uncensored in some potential policy change. So thank you both for joining us tonight.